All right, so we're back today talking about mouth cancer, a little bit different. We've been talking to a few different patients and professionals about their experiences with mouth cancer, and today we've got one of each. So we've got Dr. Catherine Tannahill, who's came on before, and also one of her patients that she actually diagnosed with mouth cancer. So it's really good to hear, how crucial that dental visit was to her catching her mouth cancer early. Just had a little bit of an ulcer on the back of her tonsil, bit of a sore throat. I was like, not so sure about this, and checked it, and Catherine flagged it straight away and sent her off for a biopsy. So it was flagged right from the word go and was able to be caught early just because she went to the dentist and had it checked out, which is one of the reasons we push it so much, isn't it, Karen?
It is, yes. I mean, that's why we have regular visits. I mean, you hear so often people say, well, I didn't need to go to the dentist because I wasn't having any problems. But it's not about that. It's about catching things, um, when they're really manageable. And it's much, much easier to treat something if you catch it early. And that goes with everything in the mouth, but particularly mouth cancers, because obviously the earlier it's caught, the less disruptive it is, and the less when they remove a tumor that's small, there is less that they have to take away, so it is much easier to the after effects are much less because
Mm-hmm.
you're treating something when it's small.
Yeah, and Martine, who was the lady that was diagnosed with mouth cancer, we had a little bit of a chat after the recording stopped. So after the chat you're going to hear, and I did say to her, like, it's just such a testament to how important it is to go and get those regular checks, because so often the people we speak to weren't that lucky, and their cancer didn't get caught early, and it's led to a lot more complex treatments. And it's how to phrase, she's not lucky, but it's lucky that it was caught early, if that makes sense.
Yes, I understand. I mean, obviously we wouldn't, it isn't lucky to get cancer, but it's, if you're going to get cancer, then you want somebody like Catherine who finds it very, very early, because that is lucky that she was in the right place at the right time and got the diagnosis early, because as we know from the statistics, that the majority of patients are at stage 4 before they're diagnosed. So that's why it is so important that you go to your dentist, or even if you haven't noticed something yourself, your dentist will see it. So I know we say red or white patches, ulcers that haven't healed within 3 weeks, go and get them checked out. But you may not have noticed anything, like obviously, like sore throat, just a little an ulcer on the tonsil. It may not occur to you that this could be something more than just a regular sore throat and an ulcer. So
Mm-hmm.
that's why it is important that to get a professional to have a look at it,
Yeah.
because they'll know, they will be able to see if there's something that needs checking out.
Yeah, and 9 times out of 10 it probably will be nothing, but why take the chance?
Absolutely. Yeah. I mean, like you say, dentists would rather refer 20 patients to just catch the one that isn't
Yeah,
lucky.
exactly.
So that's why we would want anybody, if you notice a change, if you've had a sore throat or anything that is lasting longer than normal, we all get colds and cough and sore throats and that kind of thing. But if it's lasting longer than normal, or if it's affecting your voice as well, so get yourself checked out.
Yeah, definitely. And we'll hear from them now and have them share their story together. And yeah, like I say, she's got a lot of interesting things to say and share, as does Catherine. So yeah, hope you enjoy. So really quickly, Martine, do you want to just introduce yourself? Just who you are, what you like to do, what are your hobbies, just anything about you that you'd like to share?
Okay, yeah. Hi, I'm Martine Clark. I live in Moulton in North Yorkshire. I work as a optical assistant at Specsavers, and I like going out walking mostly.
Mhm.
I also like knitting.
Lovely.
And
Oh, nice. And so obviously we're here talking about mouth cancer, and I know that you have an experience with mouth cancer and that it was actually picked up at a dental appointment. Can you just walk me through what that process was like? Were you going in knowing, oh, I've got something that doesn't feel quite right, or was it a complete shock?
it was, I'd had a sore throat on and off for several months over the winter, but I didn't really think anything about it. So when I had a routine dental checkup with Catherine, I just asked if she could have a look. So she was really great. I mean, she did a thorough check and she just said that there was an area of concern on my right tonsil. But even at that point, there weren't any alarm bells ringing. I just thought, yes, it's just something that needs to be investigated further.
Mhm. And Catherine, so what was that like when you when someone comes in and says, "Oh, I've got this and I'm not quite sure," what is the first thing you think? Generally, is it mouth cancer, or is that not a even suspicion at that point?
9 times out of 10, when somebody's concerned, it isn't anything suspicious. Probably more frequently than that, it isn't anything suspicious. We always do a thorough check as part of our dental health examination, so that is normal and par for the course. But of course, if somebody had a particular area of concern, we'd look at it even more thoroughly to
Mhm.
give that reassurance. Usually, in Martine's case, I looked and knew straight away that it looked unusual, and I never want to alarm somebody at that first instance, because actually until it's biopsied you can't be sure. You can just have a suspicion, really.
Mhm.
So I didn't want to worry Martine unduly at that point.
Yeah, of course. Martine, if you don't mind sharing, what was the process like beyond going for that dental appointment, going for your biopsy? How did you find the process from there onwards?
It was quite straightforward, really. I got referred to see a consultant. He recommended that I had my right tonsil removed, and then I had the tonsillectomy. And even at that stage, I thought, right, that's it. The tonsils have gone. That's the end of the story. It was a few weeks afterwards that I had the results of the biopsy, and that was when I had the cancer diagnosis.
Mhm. And was it just the tonsillectomy treatment-wise that you had, or did you go through any of the other? So when we spoke to other mouth cancer patients like yourself, that's usually a mix of the surgeries, but then maybe radiotherapy is involved, or they have a neck dissection, so taking the lymph nodes out. What was your experience like treatment-wise?
Treatment-wise, I knew sort of at the time when I had the diagnosis that the cancer hadn't spread anywhere else in my body. I'd had a head and neck MRI scan, and I'd had a PET CT scan. So that was the very positive news that the cancer hadn't spread any further.
Mhm.
I had 6 weeks of radiotherapy treatment, and that was daily visits to the Leeds Cancer Centre. And because the cancer was in its early stages, it meant that I didn't need chemotherapy as well. So it was just the 6 weeks of radiotherapy.
That's fantastic. Yeah, and it just shows how important it is to catch it early as well. I mean, I know, Catherine, we've spoke before about really the importance of catching it early, but it just hits it home, doesn't it?
Totally. That early diagnosis is so critical. Mouth cancer can be quite debilitating. Martine was lucky, it was very contained. I've had patients who've had to have quite severe surgery and neck dissections, like you say, and it can affect their speech, eating, drinking, any swallowing, can be quite disfiguring. So the earlier it is diagnosed, the better, the simpler the treatment. And 90% will survive with an early diagnosis.
Yeah. I don't know if it's known about enough that the dentist is actually checking for that, because I know before I started working with the foundation and with dentists regularly, I had absolutely no idea. So it's really good to hear that this is something that is regular practice.
Yeah, it is part of a routine dental health examination. I'm not so sure that every dentist is telling the patients that's what they're doing, but they will be doing a mouth cancer check as part of their dental health examination.
Mm-hmm.
And, you know, it does give us the opportunity to catch things very early, because quite often these lesions aren't symptomatic, they aren't sore for quite a number of weeks or even months. And it's only usually when they become sore that a patient might ask you about something. So
Mm-hmm.
it's more likely that you would notice something yourself if you were doing your own mouth cancer examination. So I think that's quite an important thing to highlight, that we all should become better at being familiar with the inside of our own mouths, as well as having a routine dental health examination on a regular basis.
Mm-hmm. And I will say as well, we have guides on our website to go through how to check your mouth for mouth cancer, how to feel for things that might have changed, and guidance on how to do that effectively. But yeah, nothing's going to substitute going and getting it checked by a professional. This is just something to do on top of those regular visits to make sure you're keeping on top of your health as much as you can. Catherine, so with other cancers, generally the guidance is if it's different for 3 weeks or more, then that's when to go and get it checked. Is that the same for mouth cancer?
That's the same for mouth cancer. I think, you know, if you see an ulcer, people get ulcers for all sorts of reasons. Don't panic, just keep an eye on it. And if it's persistent, if it's there for 2 or 3 weeks or more, that's when you should get it checked. If you found something that looked like a swelling, again, keep an eye on it and go and get it looked at. If you're concerned at all, just go and get it looked at, because worrying is not a good thing. You know, go and ask a healthcare professional, let them have a look, and hopefully put your mind at rest.
Mm-hmm. And something I've been asking everyone that we spoke to this month to share is if they have any words of encouragement or advice for anyone that might be either in a position of worrying for results about mouth cancer, or maybe going through the treatment process or out the other side. If you had to share any words of encouragement from your experiences, either of you, if we start with Martine, what would you share if you could say anything to someone that might be in the same position?
I think I would say take it a day at a time. I had wonderful support from friends and family. I mean, I can't thank Catherine enough for her intervention, and also, you know, the care and treatment from the NHS as well. When I was going through treatment, I mean, it wasn't great. I had constant mouth ulcers, and it was very painful. But the cancer care team, you know, they were always there with things to try and make things more comfortable for you, and that really did get you through the process. And then to come out the other side, you know, you just feel that you never take anything for granted again. Yeah, it's just wonderful.
Yeah, absolutely. And Catherine, what about you?
I think for me, I do see other patients with quite severe surgeries, and to see them come through and out of the other side and then on a road to recovery is really heartening. You know, sometimes it can be quite severe surgery, it can look quite disfiguring, but you know, the surgeons are amazing at what they can do, and time is a great healer, quite literally. And you see people immediately afterwards feeling quite sorry for themselves, quite rightly so, but then a year down the line and they're more back to their normal selves, and it is fantastic. So if you are going through it right now, hang on in there. As Martine said, take each day at a time. There are brighter days ahead, absolutely.
Yeah, a lovely note to finish on. So thank you both for sharing, and especially Martine. I know we say this a lot, but we can't do the work that we do without hearing from the people that have been through it. And we can shout about facts and figures all day, every day, but it doesn't quite hit home as much as people like yourself who can put yourself out there and share your stories. And so, yeah, thank you for both of you for talking to me.
Thank you. Thank you, Martine, from me too. And thank you, Sophie.
Yeah, it's a lovely note to end on. They they are right in what they say. There is a light at the end of the tunnel, and you will reach the end of the road, and it will be worth it. It's going to be tough, but if you're lucky enough to catch it early, then you've got much less complicated a road to travel down.
Yes, absolutely. And it's lovely to hear positivity about looking at the treatments, and the fact that somebody can be so positive when they're going through so much. And hopefully it will give people who are going through the same thing just a bit of hope, just to know that it is possible. It does take a long time. The treatments can be debilitating at the time, and but you can get through it. We've seen with a lot of our ambassadors that they come out the other side, and it's a positive message to go get something sorted early. Like I said before, don't think that you're bothering them. Don't think that you're worrying somebody for no reason. Make sure you go. I think we're very much like that in this country. We kind of go, well, I don't want to make a fuss, or I don't, it's nothing, it's just something that I've had a long time. And I think we don't want to waste people's times, but as I said before, we would rather have patients waste our time just to catch the one person that isn't wasting time. It's never a waste anyway.
Yeah, absolutely. And if you want to learn more about the early signs and symptoms, our website is mouthcancer.org. We'll put all of our information in the description of the podcast, as well as some support services that you might want to access. And also Catherine from Portman Dental, we'll put her information there as well, as she was kind enough to spare her expertise. And same with Martine. If you want to learn more about her and her journey, you can find that out below. But that's it from us for now, and I'm sure we'll be back another time talking about something else.